Good morning, Seattle. It's 10:30 a.m. and you're watching GG News. Today, we have with us a group of doctors specialized in sexually transmitted diseases. The doctor from Hurtado Memorial Hospital are with us to present one more cases of AIDS in patient Patricio Garcia.
Good morning, City of Seattle. We want to thank GG News for inviting us.
Here to report on this case and to announce the measures that will be taken.
Do you remember the great impact of the world when it was announced that the singer Freddie Mercury had contracted this disease?
Yes, indeed, Fatima, it was very memorable event for both entertainment and medical history. Are we reliving those times?
We wouldn't say exactly that. Yeah, it is the same disease, but there are really different cases.
Do you think you could explain the difference in the cases?
Sure. To give some context, we could infer that he contracted the disease at one of his many parties and or casual encounters, where he fully explored his sexuality and his newly discovered sexual preference. However, the cases of the patient Garcia is different because of the way in which he contracted the disease.
Could we know how he contracted this disease?
We ain't here to create a bad name for any other medical center, but patient Garcia's illness is due to medical negligence.
Patient Garcia, could you tell us about your experience and how you contracted this disease?
Uh, sure. What really happened was that I went to get an influenza vaccine, and apparently the people who attended me used an unsterilized needle, and as a result, I contracted the disease.
We really regret your case.
But tell us, Mr. Garcia, how did you notice that you were sick? Did you have any symptoms of this disease or what?
In fact, initially I had headaches, sore throat, and I felt fatigue. I started to have a fever, and that's when I decided to go to the doctor. He thought it would be a normal cold, but when I started to lose weight and suffer from recurrent infections, I came to Hurtado Memorial Hospital for tests, and the results confirmed the presence of HIV in my body.
It is very interesting to hear how this virus comes to affect a person.
And how was this diagnosis made?
Yes, it was through vein culture, which consists of collecting blood from the vein.
I would like to ask you, doctors, how will you approach or what treatments will you use with the patient Garcia?
The treatment that will be used will be the antiviral treatment, which is ART. It is a combination of anti-HIV drugs called treatment regimen that must be taken daily.
And in medical terms, what would be the kind of immune response the body goes through, active or passive?
It is an artificial passive immunity because it comes from injected antibodies created within a different person or animal. These antibodies containing preparations are termed antiserum.
Could you tell us about some chemical barriers and how they eliminate pathogens?
Intact skin and mucous membranes, stomach, acid, and antibacterial substance in the body fluids can be involved here. The skin and mucous membranes secrete proteins that kill many of the pathogens they come in contact with. The stomach protects itself from being digested by its own enzymes or burned by the corrosive hyaluronic acid by secreting a sticky neutralizing mucus that adheres to the stomach walls.
That's interesting. Could you tell us how we can prevent this infection?
Yes, of course. You can use strategies such as abstinence, that is, not having sex, never sharing needles, and using condoms correctly every time you have sex. You can also take advantage of medications to prevent HIV. such as pre-exposure prohyalics and post-exposure prohyalics.
It is also very important to sterilize and keep clean the objects that come into contact with your skin and to not contract any disease.
This information will surely be useful. We thank you very much for accepting our invitation here in JJ News and sharing your notice with us.
The honor was ours.
And I would also like to thank the patient Garcia for sharing his story.
It was all very entertaining. Thank you for your interest and for making people a little more aware.
Thank you very much for everything, Seattle. Stay tuned, and after the commercial break, we will have more information about the weather and more important events. We will come back.